Imagine being unable to read for decades. For many, that was the heartbreaking reality. But a revolutionary new implant is changing lives. Meet Sheila Irvine, a 70-year-old woman who is registered blind. After receiving the Prima Implant at Moorfields Eye Hospital in London, she can read again. Sheila describes the experience as out of this world. This groundbreaking technology targets geographic atrophy, a severe form of dry, age-related macular degeneration. This condition affects over 250,000 people in the UK alone, leading to blurred or distorted vision. So how does it work? The Prima implant consists of a tiny microchip inserted under the retina. Patients wear glasses equipped with a video camera. This camera captures video images and sends them as an infrared beam to the implant. The implant processes these images and sends them back through the optic nerve to the brain. After some training, patients can interpret these images, regaining some functional vision. In an international trial involving 38 patients, 27 reported they could read with their central vision after receiving the implant. Sheila, who had lost her ability to read for over 30 years, can now read letters and enjoy crosswords. While the procedure requires concentration, Sheila and others like her find joy in newfound independence. "I am able to read my post, books, and do Sudokus," she shares. However, the Prima implant is still in clinical trials and not yet widely available. Medical professionals like Dr. Peter Bloomfield express optimism about future accessibility, particularly through NHS programs. This technology not only offers hope for those with geographic atrophy, but also opens doors for advancements for other eye conditions. As Sheila puts it, "It is amazing. I am one happy bunny." For more updates on this exciting technology, stay tuned.